Hello, I'm Colonel Michael Greenberg, Fort Belvoir Garrison Commander. Thank you again for joining us this week on our virtual Facebook Town Hall. We appreciate the opportunity to continue to update you on the installation's COVID response, and more importantly, to address any questions or concerns you have. Like always, I have Captain Cindy Judy with me, the Director of the Fort Belvoir Community Hospital, and she'll also give you some updates as well on the hospital and answer some questions that you have in regards to the hospital and some of the other medical conditions and conditions out there. And so before we begin, I just want to update you, I just want to share a couple of announcements starting out. In recognition of the Asian American Pacific Islander Heritage Month, Fort Belvoir collaborated with Colonel Heidi Urban, who's the 704th Military Intelligence Brigade Commander at Fort Meade, to present a video highlighting the contributions of our Asian Americans and Pacific Islanders in our history. And they really focused on 442nd Regimental Combat Team and their accomplishments in World War II, one of the most highly decorated units in our nation's history. So stay tuned for that. It'll be posted tomorrow. I think 11:30 is the time, but you'll see it out on our Facebook site. Also, I want to let you know, just a couple hours ago, I had the honor to host a virtual Memorial Day observance ceremony. And hopefully you were able to see it live, or you're able to see that video as it's out there on Facebook. Special thank you to Lieutenant General Darrell Williams for his participation in the ceremony, and he also acted as our keynote speaker. Just to remind folks, on Monday at 3 p.m., I encourage you to join the annual National Moment of Remembrance by pausing for a minute of silence to remember and honor those who have died in service to this nation. I just want to share the first paragraph of my letter that's going out tomorrow. At this time, I'll share the second paragraph at the end in closing, but it's a Memorial Day safety message. The first paragraph reads, on Memorial Day, which will be on 25 May 2020, we salute all the military men and women who paid their ultimate sacrifice while serving our great nation. We mourn their passing and honor them for their courage and dignity. We also extend our deepest gratitude to all Americans who continue to serve our country around the globe, ensuring our security and protecting our freedom. And so with that, I will pass it over to Captain Judy for her remarks.
So good evening, everyone. Thanks, sir. First, I wanted to just wish everyone a safe and happy Memorial Day weekend, recognizing that 1868 was the first observance. And so my week's thank you is really to all of those Gold Star families that are out there. We honor you and we remember you. And then the other thank you that I would like to point out this week is for all of the installation chaplains. I know at the hospital we've had a ton of chaplain support from our team and then from other folks as well. And I think that the chaplains are one of those groups, like the teachers, like the hospital, like so many, right, the CDC, security, that have really had to flex the way they do their mission to support people. And they've done a phenomenal job doing that, whether it's virtual services or that one-on-one support that they're giving. They've really gone above and beyond. And so I just wanted to start off this week by recognizing the chaplain team.
Thanks. Okay, you want to go through any question and answer? You want me to continue and then we'll do them at the end?
We'll do them at the end.
Okay. You can tell how rehearsed we are. Okay, so just a couple others. So if you didn't notice, we started bringing up special guests to talk about special areas. So last week we talked about the FCC homes. Again, I want to reemphasize that we are still looking for folks. We did talk about the $1,000 incentive fee for starting an FCC. We talked a lot about the program. Again, if you have questions or concerns, send your note off to FMWR and those could be answered. Today our special guest is Amber Flores, who is our Chief of Physical Security. Amber, you can come up. But she's going to talk about our visitor center and some of our preparations as we open back up, some of our online registration mechanisms, and just our way of going forward. So with that, I'll turn it over to you.
Thank you. Good afternoon. I'm here to discuss our new virtual expedited visitor pass procedures. So we teamed up with PAO over the last couple of weeks to help streamline the process for receiving your new initial pass, as well as requesting a renewal of passes. We understand it's been difficult and time-consuming to renew passes currently, and we have been extending the length of passes, but I think this is going to be much more helpful. You'll get your pass for the same time and durations that all of your passes have been. Currently, you have to go to Tully Gate probably about 3 times to renew a pass, or if you go that one time, it's only a short-term pass, so we're actually really excited to announce this procedure. It's going to alleviate multiple trips to Tully Gate. You'll only have to go one time. Your pass will already be printed and ready for you. I'll just discuss it quickly. You'll submit your pass online. Within 72 hours, your pass will be printed and waiting for you to pick up at Tully Gate. And they'll be for the same duration. So we have 2 types of passes. You have your unsponsored pass. There'll be no change. It's valid up to 90 days. And then you'll have your sponsored pass that you can renew up to your 6 months or a year, depending on the reason for your pass. And again, both will be printed and ready for you for pickup at Tully Gate. So we just want to discuss it. Actually went live today. All you have to do is go to the Fort Belvoir homepage. You'll scroll down on the right-hand side. You'll see a link that says Installation Access and Gates. You'll click that link. It'll pull you up to a new page. It's Installation Access and Visitor Information. The one side does discuss our gate hours, what's open, what's not open, and any changes will be reflected there. On the right-hand side is where you'll actually click. It says New to receive your expedited visitor access service. Once you click that link, it'll pull up a more explanation of your 2 types of passes. And then you can click your pass. It's awesome. You actually just click the pass you want. It pops up for a fillable form. You fill it out online, you sign it online, and then you just submit it on email to the visitor email, which is also on the same link right in the same area. And then within 72 hours, your pass will be ready. You will get an automated message that tells you procedures of how to pick it up. I will cover it real quick. You still have to go to Tully. You will go under the commercial and truck visitor lane. You'll present your ID and tell them you're there to pick up your expedited pass. They'll find your pass, compare your ID, and then give you your pass and you're on your way. Again, it'll be good for the 90 days or the sponsors for 6 months to a year. And I do want to reiterate a few things. All visitors 16 and older must have a valid ID to come on the installation, and not just a driver's license or school ID or military ID. If they don't have a military ID, they must get one of these passes. So it's still 16 and older. We also want to talk about Real ID. While we're not enforcing Real ID Act, if your ID says not for federal use or limits, federal limits apply, you must have a second form of ID. And all of those links are actually now on the website, so you can click what are approved secondary IDs on the same web page. And then the last thing is there is also a link for the new Veterans Health Cards as well. So if you want information on that, that's also been added to the website. Other than that,
Thank you.
thank you.
Hopefully that information is helpful to you. And so next week we have Major General Jones, who will be our guest speaker. And then the following week, we're going to bring in Mr. Brian Hill, who's the Fairfax City Manager. So again, trying to change things up and get some special guests in as well to talk about their areas of expertise. And so last week we talked about the reopening framework. We shared it at the Fort Belvoir Eagle, and then we also posted it on social media. And there's been a lot of discussions and questions about when things will start. And again, last week I talked about it. I'm just going to reinforce some important points from last week. You know, first, if you look at the timelines, there are no dates associated with the timelines. Our actions don't necessarily mirror outside the gates. Everyone knows that although Virginia is open for non-essential businesses, Northern Virginia is still on a hold pattern, stay-at-home order until the 28th or 29th of May, that Thursday night. And so We are waiting to see whether that will be extended or not. Again, more to follow. But our areas, Fairfax County is one of those areas that have been told to stay at home at least for another 2 weeks. So we continue to monitor those. So that is one condition. Again, no dates associated with that. We also are working with Department of Defense, and we'll talk here about one of the memos that was just issued to us, but also Military District of Washington, and they really are coordinating across the National Capital Region as a whole, and so they are analyzing not just Northern Virginia, but DC and Maryland as well, and coordinating efforts with the Pentagon, and then all the leaders out there as well to make sure that we are all seeing the same site picture in our areas and doing coordinated execution of a plan. And then we work with the hospital, of course. We have a public health emergency officer and then Captain Judy as well that we continually work with. And then they're also working with Fairfax County Health, and we also have interactions with our local officials and then also our state and the governor's office. So again, all those are being looked at and coordinated before we actually reopen our activities. So yesterday, the Defense Secretary put out some guidelines to commanders on changing local health protection condition levels to ensure that our bases start opening, begin planning to open under normal conditions. And so there's a lot out there in the memo. I am going to have, if she can, Captain Judy talk about some of the key conditions that, again, General Jones is the one that will regulate our HPCon levels, but these three primarily things are what he's going to consider as we look at HPCon levels, and then as the garrison commander will look at individual activities under the framework to open based off of those. So if you can answer that.
Yeah, I'd be happy to answer some of that. So there's really 3 triggers in that Secretary of Defense memo from the medical community that they're looking for to help from the medical advice to General Jones to look at the HPCons. The first is symptoms. They're looking for a downward trajectory of reported cases preceding 14-day period. We're not there yet. Things are looking up, but what I can say is we're not quite there yet when you're looking at the symptoms. The second thing is cases. They're looking for that same downward trajectory over a 14-day period of percent positive. So out of everyone who's tested, what is that percent positive? So full disclosure, right, if you go to the Fairfax County webpage, you can see the percent positives. They put that graph right out there, and so you can see what's going on right here in Fairfax County. That is one of the data points that we're looking at the hospital. We're also looking at the percent positives coming right from Fort Belvoir Community Hospital as well as in the National Capital Region. And we get those briefings, and we do the briefings to the National Capital Region every morning. So if you look at Fairfax County, it's starting to look promising, right? That trajectory was going up for a while, and it's kind of peaked, and it's sort of a little bit up and down right now, but there's some promise there, okay? NCR has been fairly steady, although we're doing a lot more testing now, and the criteria for testing has changed, and so we're trying to control for some of that. And Fort Belvoir Community Hospital, we saw a little bit of a downturn, and then we saw another upturn, so we've been a little bit up and down. I know that that's really frustrating to hear that, right? I'm a planner myself, Colonel Greenberg, and so I've read all the comments on the Facebook page, right, in the comment section, and people are like, you didn't tell us anything. And that's because we have to monitor all of these data so that we can inform General Jones to make those decisions. And so we're just not quite there yet. The third criteria or trigger that he can use then is whether or not the medical facility has everything that it needs to go back to full scope care at the hospital without any concerns for personal protective equipment, testing capability, additional exposure, and things like that. And so we are adequately staffed, and we are adequately equipped to care for all of the patients that we've been caring for. We are not to a point where we could bring 100% of the patients back in person and have all of the PPE and testing capability if we start to see that surge go up again, okay? And so, so we're not quite there yet either, but our surgeries have increased, the number of appointments available have increased, and so we're making progress in that. So for all the planners out there who were looking for give me a date because the state said this and restaurants are starting to open, It's not gonna be that same way. We're gonna operate based on that SecDef memo. We're making progress, but we're just not quite there yet.
Okay, great. And hopefully that answers some questions. Again, I know that's not exactly what you want to hear. You want to hear on X date we're opening, but there, you know, and we talked about last week about laying out each of the services on the installation and making sure we have mitigating strategies, whether it's a high risk or a low risk activity. We'll also decide whether we open it up front or in the back and in the back end. And so there's comments out there, hey, why is the chapel opening past the golf course? The chapel's more critical than the golf course. And I would tell you, or the barber shop, and I would tell you, it's not only based off of the criticality of the activity, it's also based on the risk level of the activities. So if we can mitigate risk down to a low level, it may not be the most important activity on the installation, but it still may open earlier than a more critical service. And so as we go through those, you got to understand that it's not based off the highest priority, it's based off of what can we provide back to the installation and assume little risk that we don't have a spread of the virus. So again, that goes to a couple of the questions out there. We are continue to coordinate with the hospital and the public health community really on the assessments. We are still doing those weekly as we open more activities. The hospital continues to go around and make sure our assessments are done, and we're following everything with CDC guidelines. So that is out there. The other thing that happened from last week to this week is General Jones extended the public health emergency. It was going to expire in middle of May. He did extend that out for 90 days. So now it is actually through the middle of August. And so again, I don't want to confuse the community with what the public health emergency does compared to what HPCon levels do. Because we can start to go down to an HPCon Bravo, but still have a public health emergency intact. And what that public health emergency really does for us, it provides me as the garrison commander authorities that are needed to enforce standards. And so, as you know, we have temp policy letters out there. I think one of the questions was, can you post a link where our temp policies are? So if PAO just sometime in the next couple minutes can post that out on the chat room, I'll post the site where you can see those policy letters. But the face coverings is a good example of one of those that without the public health emergency, I have challenges on enforcing those standards. And again, the standards of not wearing face coverings in the commissary, PX, hospital, all those places where you can't maintain the 6 foot distance is important to protect the community. And so again, as General Jones looked at the public health emergencies, he looked at all those authorities that we really need to continue to protect the community right now, and determine that was the right time frame. But again, don't confuse that as we open up activities, don't confuse that with opening activities and not being in a public health emergency and the reasons for that. So again, hopefully that makes it clear to everyone. So where are we now? So last week we talked barbershops. We talked a lot of the different mechanisms. We said, hey, it's for service members starting out in uniform. And so when we do have a date, and I'm going to delay one more week on the date of opening, it is coming up in the future, again, but it's conditions based. And so we're basing one of the conditions that on Friday of next week, Fairfax County will open their non-essential businesses. So before putting a date out, I got to confirm that actual condition is met. And again, that condition is going to be met based off of other conditions the county's looking at. As Captain Judy said, they're looking at those indicators as well. And so the barbershop should open in the next couple weeks. Again, with those mitigating strategies of by appointment only, service members up front in uniform, the social distancing, 50% capacity, and everything else that we laid out last week. The golf courses, again, I put out kind of what the conditions would be. Not going to announce any dates right now because, again, it's conditions based. We are looking at that. But again, we have to balance between what's going on, conditions outside the gates, which again, outside the gates, golf courses are open, but we also got to look at conditions on the installation. We are still at HBCon Charlie. We're not going to go down to Bravo this week. I can guarantee you that. I can't tell you when we're going to go down to Bravo, but it's not going to be this week. And so again, as we see the indicators go down, I think we know we can perform that with low risk, but again, we are standing fast for at least another week or two to see where the conditions are, and then we will look at that as well. I also want to mention two more things. So in the paper, we have in the upper left corner of the paper this week some resources for childcare, and so that is out there for different areas. I did have a great conversation today with Northern Virginia community leadership. A lot of the supervisors were on the line, the city manager was on the line, Secretary Hopkins was on the line from the governor's office about CDCs, Child Development Centers, and kind of the impacts here on the military installation. I do want to talk briefly and put out a little bit more last week. I talked a little bit about it. I didn't give a lot of concrete data. This week I'm going to give a little bit more. Again, we are still in the planning process. Like last week, I said we're going to start initial notifications. We are going to start those, but we're starting from the back end first. So those that we know we cannot accommodate, we are starting the notification process. For those who are in the front end, we are providing more priority lists in writing, and so the parents of children in our care will receive a letter signed by me tomorrow with more information out there on what forms look like and what the priorities are. But just to lay it out in general terms now, again, there's more in the memo, is we already know that our capacities for our child development centers are going to be significantly decreased based off of the guidelines out there, 10 or less in each one of our rooms. We also know that, for instance, infants, there's a 4-to-1 ratio. That means we can have 2 groups of 4 plus 2 care providers in there. But again, some of these age categories will max out before others. So we got to understand that as we go through the priorities. So the priorities in HPCon Charlie, again, they're no different than what we put out already, but it'll be in writing as well, is those vital families that are there right now are in priority 1 or are those that are being seen at the daycares. Okay, that will not change. But what will change is we are revalidating those and sending those revalidation forms out to the community, and we are asking you to get with your supervisors, and those will be validated and actually signed by 06 commanders or directors, or GS-15 and above commanders or directors. And again, that's outlined in here. So priority 1 is those vitals in HPCon Charlie, and then it expands out to mission essential as we have capacity in our child development centers. Right now we have 1 consolidated child development center. As we start to decrease to an HPCon Bravo and Charlie, or Bravo and Alpha, we will start to increase the child development centers, but also understand as we increase even to full all CDCs, that the capacity in each classroom is going to be degraded based off of restrictions we have out there. And so after we get from priority 1 and priority 2, which is those vital and mission essential, and it's for those personnel who are assigned to units that are on the installation or those residing on the installation, then we go into our DoD priorities. Okay, in our DoD priorities, again, CYS direct care staff, and again, keep in mind as we open more of these facilities, those CYS direct staff have priority to be their children to be filled, so then they can assume duties in our child development centers. And then priority 4 is our single dual military, followed by our single dual DoD civilians, and then priority 6 is military DoD civilians with full-time 40-hour working spouses. So again, those are our priorities out there that we've laid out. We will go through that roster. But as we go through those priority lists, after we get through the mission essential, and even with the mission essential, we start with those DoD categories, and then if we stop in the middle of one of those DoD categories, we then work our way through income categories. So if I'm in priority 4 and we stop in the middle of priority 4, then those who have lower incomes as a family will be at the top of the list and will be serviced first. and then we will go down at income levels until we get to our max capacity inside our child development centers. So again, that's type of the logic that we have out there. Again, a lot of the data will go out tomorrow. We're going to ask for those mission essential forms back from all our parents, and then we will continue to make phone calls and try to get a good list out there as we start expanding care out to additional families, that those families know that where they are on that list, and when they think they would see care. But again, if you're looking for a date, we don't have dates. It's conditions based. It's also off of HPCON levels. So we are in our preparation phase right now to begin to bring employees back to work. We're not there yet, but we're in the planning phases, to initiate that. I think there was a question out there from someone about hand sanitizer, and someone said, I'm a nurse or I'm a healthcare provider. Can we extend the amount of hand sanitizer that we can get from the commissary and the PX? And the answer is no. And the reason why is commissary and PX is really for our beneficiaries and for our families. I will tell you, if you are working on this installation, if you're working at the hospital, you're working in the child development centers, you're working in any of the installation or in your mission partners, that stuff will be provided to you. And so I would tell you, if the question came from someone who worked at the hospital, I would tell you, talk to your hospital staff, but talking with Captain Judy, we have the full understanding that everyone's provided that hand sanitizer. If you're working for an employer outside the garrison or outside the installation, then I would put, if you were needing it for your workplace, that's part of opening up these activities, making sure the proper personal protective equipment is on hand, to include hand sanitizer and hand soap. And so if you work for a healthcare provider, or you have your own business for monitoring folks, or you're doing home care, I would tell you to talk with your company and find out if they provide that stuff, and bring that up to them. But as far as showing your card at the commissary or PX, I can't approve that request at this point. So hopefully that was more data on child development centers. Again, as we go forward, we will continue to keep you updated. Again, my mantra or our way of doing business over the last 8 weeks has always been be transparent to the community as we can, which we have been, to tell you up front as soon as we know information, date, times, conditions, that we'll let you know, and there's going to be no difference in this as well. If you remember, I've been talking about child development centers for about 4 weeks now, and my initial guidance out to folks is you probably need to find an alternative care site. If you're not vital or mission essential, I'll continue to say that, because again, Fort Belvoir hosts a whole lot of very large agencies. And again, let me also, I didn't say this up front, but let me be clear that when we're talking mission essential and vital, that we're talking both the service member and the spouse, if it's a marriage, if they're a dual parent. And so that's very important as well, as we're sending these forms out, and they have to be DOD, GS, or military for these mission essential or vital. Again, making sure we're providing that, and then bringing, allowing others in the other priorities to also have service. So with that, I am going to open it up for questions and answers. Do you have any questions?
I do. There's been a couple that have come across that are they're themes, right? And so in various formats, but people keep asking about school or sports or camp physicals. And so appointments are available in family medicine and in pediatrics for those physicals. In addition to that, in a future date, we're going to coordinate what we'll call a rodeo, and see how we can get lots of people through, socially distance and all of that, very time efficiently. But right now, if you were to call 231-1803 and option 1, you can make an appointment. Again, that phone number is 231-1803, option 1. So you can make an appointment for that. The other question, and somebody beautifully stated their question, they may be in the medical field, I'm not sure, but they said, will Fort Belvoir Community Hospital be administering COVID-19 blood testing for immunoglobulin IgG and or IgM for asymptomatic individuals who've been exposed? That really is antibody testing that the question is asking, and we do get a lot of questions because people see that on the news and so on about antibody testing. I'll tell you, the current practice management guide advises against the use of serologic testing for patient screening because there's high false positives and high false negative results. And there's no proof that having antibodies to COVID protects you right now from getting COVID again. So we are not doing that testing at this time. There are currently no FDA-approved antibody tests available.
Okay, great. Thank you. As I'm going through a couple of my questions, if I can have Chris Landgraf come up and get ready to answer the Public Works questions. But a couple of questions. One question, can first responders be included with active duty for gyms? The answer is no, not at this time. However, we will work with our first responders to make sure they have some availability at the gym. It may not be at the time of active duty, but again, and that's initially starting opening the gyms. Again, I didn't specify timelines for any of our activities, but some of these barbershops, salons, gyms, some of the other items that we're restricting to service members at first could be days, and it could be weeks, or it could be months. Again, it's going to depend on the capacity of each one of those locations. It's going to depend on CDC guidelines as those change. Capacities could change in the gym and our other activities. And so no answer no when we initially open the gyms, it'll be for active duty, but I will have the Director of Emergency Services talk with the Director of FMWR, and we could potentially work out a different option for you. Will fitness centers have a capacity cap? The answer is yes. Again, just like the commissary and other locations, it will. I'm not going to put a number out there right now, but we will. The equipment is being repositioned, and so treadmills will be 6 feet apart. Different workout apparatuses will be 6 feet apart. So obviously, there's going to be less areas to do workouts, and then time frames will be limited to an hour and a half or 90-minute sessions. So it gives time to actually clean those areas. Do you have an accessible link to memorandums you've signed regarding COVID? I think we've already posted that out there. If not, we will post those out. There's been a couple questions on religious services not being reopened in a limited capacity till HBCon Alpha. Understand your concerns. We got some SecDef messaging yesterday that has a little bit more guidance on religious services. We will look at that again, so I'm not wedding us to only opening in HBCon Alpha. But again, you got to understand, it's not about what's a more priority or a higher risk, golf courses or religious, activities. It's more about risk factors. And so some of our services that we have on the installation sometimes have seatings of 400 people. And some of those individuals are in high risk categories. So the risk level of hosting a service, religious service, is a lot higher than, we'll say, opening a golf course that has one person per golf cart. And so neither is opening today, but as we look in the future, I understand your concern. I applaud the religious support officer and activities. We are doing all services out there now on Fridays and Sundays, and I believe those have been very successful. So hopefully you're getting that virtual capacity and virtual capabilities out there for our religious support. Okay, I'm going to turn it over. Go ahead.
All right, sir, thank you. This is Chris Landgraf, the Acting Director of Public Works. I have 3 questions that were posed to us tonight. The first one is, can we get the parking spots repainted or restriped at the Warrior Pavilion? The answer is yes. We're working on that through our asphalt contract, and we'll try to get that done as expeditiously as possible. Second question is, what is the current PPE requirement for maintenance when entering the home for emergency or urgent call? The answer from our village partners are that when technicians from the villages at Belvoir respond to emergency or urgent work orders, they are required to wear PPE, which includes gloves, a mask, and shoe coverings. If they're not doing that, please let us know. Third question, when can we expect maintenance to resume for normal or routine service calls? The villages at Belvoir is currently completing routine work orders that do not require entry into residents' homes. The village's team is working closely with the garrison to develop a plan for resuming normal operations. Residents will be notified in advance when routine services will resume. And finally, when routine services do resume, precautions will be taken to ensure that the safety of both residents and the village's staff are taken into account. Thank you, sir.
All right, great, thank you. And I'm just gonna expand a little bit more on our housing and work orders. So I would ask from our residents as well to make sure that you are keeping our maintenance workers safe as well. They're wearing face coverings and booties and gloves. And so I ask, you know, if you're gonna be close to a worker, you please put your face covering in your house on as well to protect that individual. Also, utilize some of these things that you can do on your own. So if you have light bulbs out or you need filters done, they have a great service dropping off those at your door. You know, for those work orders that can be done, you know, with you on the phone with the maintenance tech, the villages are making that option open as well. And they are working on work orders that are on the outside of the houses. So again, we know, and the villages of Belvoir acknowledge that when we start to lower our HPCon levels, work orders will continue to increase, especially as we start opening up those routine work orders, that there's gonna be a lot coming through the system now. And so we've told the villages of Belvoir to be prepared for when that happens. Any other questions from the hospital?
No, sir.
Okay, is Mr. Reddick here?
Sir.
You have the answer for the Ed Center?
I do. Good afternoon, all. Once again, Kevin Reddick, Director of Human Resources. Question proposed was, are we looking at reopening the Barton Education Center for the purpose of test proctoring? The answer to that question is yes, absolutely. We're looking at all of our facilities where we deliver services once our HPCon level decreases. And so once we find ourselves in a much reduced or decreased environment and able to provide all measures of preventing any further exposure, we will certainly look at opening and look at how we will begin proctoring those tests once again. Thank you for the question.
Mr. Dixon, can you answer the CYS questions?
I sure can, sir. Thank you, sir. We currently have 3 questions. Will there be an off-post FCC anytime soon for those that are interested and live off-post? Answer, no. For those interested in becoming an off-post FCC provider, please contact your county child care offices for information and licensing requirements. Question 2, FCC, question mark, question mark, question mark, really, question mark, question mark, question mark. So you can't control the CDCs and the safety of those places, but you want people to provide child care at their homes. To which standard? Who will make sure that they are cleaning those areas? What kind of training and or certificates will these people need to have? Answer, Army FCC providers are upheld to the same high standards of care as the CDC programs, which have implemented elevated health and safety protocols to not only meet, but in many ways exceeds the Centers for Disease Control recommendations for keeping the essential care facilities open during COVID-19 health crisis. All FCC providers receive 40 hours of initial training and certification, as well as annual training in CPR first aid, child development, medication administration, communicable diseases, bloodborne pathogens, fire, safety, special needs, business practices, lesson planning, and much more. FCC homes are inspected by the fire department, installation safety office, Fort Belvoir Community Hospital Public Health Nursing. The FCC director visits the homes announced and unannounced, often to ensure compliance with Army Regulation 608-10. Providers are required to clean and sanitize their home daily and as needed throughout the day. The CYS nurse consultants visit the homes as well for training, information, and to review standards. The requirements for these FCC providers who will provide care during COVID-19 health crisis will meet the same elevated health and safety standards as the CDC's for cleaning, sanitation, and safety of the children. Question 3. My problem is that my daughter used to attend DLA CDC, and they have sent 0 information out, nothing, that are not part of the Fort Belvoir they only deal with. How do families get in contact with DLA CDC? Do they work with or have communication with the Fort Belvoir CDCs? Answer, the DLA CDC is not affiliated with nor falls under the direction of the Fort Belvoir Garrison Command and the IMCOM G9 CDC, despite being physically located on the garrison. Families attending the DLA CDC will need to contact their DLA chain of command directly with their questions and concerns. Thank you.
All right, great. Okay, do we have any other questions out there?
Yes, sir. We've had an increase in crime in River Village. A house was broken into this week. Several sheds have been broken into. Why are MPs not patrolling the village? What is being done to protect the residents?
Okay, so I'm gonna have Frank come up and answer it. I think I have an answer, but I'm gonna let the expert answer. But the question is, at River Village, they've seen more crimes in that village, and they're basically asking the question, are we doing our patrolling? Do we have security in place at River Village?
Short answer is yes, we are doing security in River Village. I believe I know the incident that is being referenced on the website. I believe a shed was tampered with a couple of weeks ago. I don't believe anything was stolen. There's some increased vandalism, and that's part of the reason for the commander's the curfew. So we believe it was a juvenile crime. But we are patrolling out there. So,
Okay, great. Now, and again, to Woodlawn and to River, who are those villages that are off the installation, we have made it a point to ensure that we do have patrols going through those two neighborhoods daily and nightly as well. We also do random checkpoints inside those villages as well. So understand the concern. Mr. Henschel has it, and we will take it back. We acknowledge the increased crime, and we will continue to patrol those areas. Another question?
Is the curfew over?
The curfew is not over. Again, just like everything else, it's based off of conditions. The conditions have not been met. We just thank you for the one crime that happened in River. Again, the crimes have been very low on the installation, but at this point, still in HPCon Charlie, and still in the conditions we're at, we will continue to maintain that curfew. I appreciate all the support from the community in making sure that happens.
Last question, sir. Do tenant organizations fall under garrison guidelines for reopening and not their component command?
Yeah, so great question. The question was, do tenant units fall under the garrison or under their unit command? And I will tell you that the coordination that's being done between the garrison, the hospital, and then all our tenants is being done 3 days a week on our commander's update briefs. And so all information is being shared. We also share our planning guidance for the garrison. The hospital shares theirs as well. But at the end of the day, each one of our tenant organizations makes their own independent call within the guidelines, the framework of the HPCon levels. And so, obviously, if we're in HPCon Charlie, again, this is mission dependent, because remember, mission assurance is one of those factors. So there are some organizations that are 100%, minus those who have high risk health issues that are back to work. But as we go through the HPCons, the guidance is given to each one of those agencies. They judge their environments, their working conditions, their employees and their employee population, and then they make an independent call on how they're going to bring back their workforce. But please keep in mind that they are also in coordination with the hospital, and they also are getting advice from the public health emergency officer as they see fit, and then they also go over their plans to make sure that it's within CDC guidance. So hopefully that answers your question. No other questions? All right, I'll turn it over for any closing remarks.
Yeah, so I have a couple of things. I know that this coming week and last week was supposed to be graduation for a lot of students that are Garrison students or supported by the installation. So I just wanted to give a shout out to them, to recognize them, whether they're high school seniors or college seniors. Congratulations on all your accomplishments. While your ceremony looks vastly different than what you anticipated your entire life, right? Your accomplishments are still worthy of celebrating. So congratulations. And then I hope that people can find a meaningful way to honor our nation's fallen over this Memorial Day weekend. One of the ways, if you're looking for something to do, I just want to talk about Fort Belvoir Community Hospital's Troop Command did a fabulous video that's posted on our Fort Belvoir Community Hospital Facebook page. We can probably share the link over to the Garrison one. But they did a virtual run, walk, bike, United We Remember Memorial Day event, and it goes through all of the memorials here. And so it's virtual, it's a self-paced, but it's a great way for you to get out there and honor the fallen.
All right, great. And that reminds me, hopefully you saw one of our videos from one of our coaches that work at FMWR. He started with a video, a very light, fun workout that you can do in your home. We're going to try to continue that type of events. I know people are missing functional training and some of our other events that we host at the Garrison. And so again, this is a way of maybe a new norm starting out until we can get back into gyms and doing some of these fitness classes. So hopefully you are enjoying that. And we'll continue at the Garrison to look at other ways that we can get the community involved and do some things that we've been doing in the past. And so I want to close with a couple of things. First, I just want to kind of go over the last portion of my Memorial Day safety message. And so this period is particularly difficult because we are under the COVID environment. The 101 critical days of summer is intended to remind us that we can't afford to lose focus. Take charge of your safety and security. Observe safe distancing, and wear protective covers. Be safe has become a catchphrase, but it conveys consideration and forethought. Be mindful of unsafe acts. Plan activities with safety principles in mind. And do not drink and drive. Get rest before long trips. And do not text while you're driving. And so as you go along for this Memorial Day weekend, I know there's normally a whole lot of events out there that we plan to do, to include barbecues and all kinds of social gatherings. Again, this year is different than other years. So I just be mindful of your activities. Remember to be safe, exercise caution, and remember that, most importantly for this weekend, please remember those who paid the ultimate sacrifice and the ultimate price for freedom. And so, again, just please remember that as we go on. Again, as always, I want to just thank everyone who is keeping this installation open day by day, to all those who are coming in physically, to maintain all our facilities and to keep them all running, to keep us safe, to keep our medical treatments going, and then those at home as well that are teleworking, that are also keeping our installation safe. You have an important mission as well. So again, we could not keep this little city open without everyone's support. So my hats go off to you, and thank you for what you're doing. Thank you for participating in this virtual town hall. As always, Captain Judy and I look forward to our Thursdays of coming here and talking to you. We will be doing this at least the next 4 weeks, but probably a little bit longer than that. I think it's been a real good mechanism for us to share not just what's going on with COVID, but also to share other activities and other events on the installation. So we'll continue to do that. Thank you for your questions and feedback. Those questions are helpful before we start, but again, we don't mind taking those as we go along this town hall. So we appreciate those. We'll continue to use our Facebook page and our websites as a resource to provide the latest information out there. Thanks for listening. Please continue to stay safe, stay at home, and wash your hands. And please remember that we are all in this together. The longer we stay at home and apart, the sooner we'll be all together. Again, have a safe Memorial Day, and we'll see you next week. Thanks again.